Hello to one and all. Welcome to CAHO's World Patient Safety Day Awareness Webinar on WHO's Global Patient Safety Challenge, Medication Without Harm. The iatrogenic medication-related harm accounts to nearly half the overall preventable harm in medical care, especially for patients in lower and middle-income countries who are twice likely to experience this. So creating awareness on factors leading to medication-related harm requires prioritization of medication safety by leaders as an organizational culture. Tackling this challenge needs implementing measures to educate, empower, and engage people and their caregivers using tools and processes. On this note, I would like to introduce our esteemed moderator for today's session, Dr. Manivannan Selvaraj. Dr. Manivannan is the founder, managing director of Kaveri Group of Hospitals. He is a trained anesthesiologist and an NABH assessor. His focus on implementation of lean methodologies and 5S practices has helped Kaveri Hospital in winning several awards in quality initiatives. And he is a dear friend of CAHO too. He is the founder CEO of Medicall, a premier medical equipment expo in India. We are extremely honored to have you here with us, sir, in our midst. Over to you, sir.
Thank you, Shobana. It's really a pleasure to be associated with a program by CAHO. And as you said, fondly remember the day CAHO was started 7-8 years back. And it's really amazing work CAHO has been doing and the various educational programs and other certification activities. And keep it up, all the best. And so coming to today's program on medication safety, we are all aware that the quality initiatives in India started somewhere in 2015 or so, when NABH was started and was slowly gaining momentum among larger hospitals. Later, around 10 years back, smaller hospitals are also included in the entry-level assessments. And according to me, my experience of way back, I read a book called "To Err is Human." Actually, basically, it's a very interesting book. It talks about safety in other industries. Also, it correlates with the healthcare industry. And we all very well know, 15 years back, it was we were not aware, actually. Say, we were not taught about patient safety or quality and all those things during our undergraduation days or post-graduation days. In fact, we all started learning after starting in hospital. In fact, I came to know what quality in the hospital is somewhere in 2015, almost 6-7 years after starting the hospital. And now, thanks to NABH and other quality movements in the country, there is a lot of awareness among hospitals and healthcare professionals, be in tier 1, tier 2, or tier 3 towns also. And medication safety is a very important part of this patient safety program. See, I personally, being an anesthetics and critical care physician, I personally have seen various incidences where near-miss events have happened and critical events have happened because of wrong medications or overdosage and other things, actually. And it was very interesting challenge way back in 2015. When to get a clinical pharmacist, I had to struggle for 3 years to get a clinical pharmacist in my town, actually. I come from a town called Trichy in South Tamil Nadu. So we found it so difficult to implement this. And thanks to all my co-assessors, including Dr. Clara and Padi and all those people, I learned a lot during my assessments. I learned from the various hospitals I visited. And we have implemented a lot of programs on medication safety in Kaveri Hospital. But personally, I realized that such dedicated program and educating the paramedics or quality professionals, doctors in this ensures that the medication errors come down significantly. But most of the time, the problems are not highlighted or brought to the notice of management. It is pushed under the carpet. That's the most important thing. Voluntary reporting of medication errors is the significant thing, most important step in ensuring medication safety is there. And all the organizations should practice reporting, should not be vindictive on people reporting or people who have committed medication errors, because we know most of the time it is system error rather than people error. And I'm sure that the esteemed speakers today will be highlighting various aspects of medication errors today. And it will be a short and sweet session. And I mean, we've got an amazing participation list. I think it will be very useful for the audience overall. Thank you. Thank you for inviting me. So the first speaker will be Dr. Jothi Clara Michael, Director of Nursing, IHH Healthcare India, and Founder Vice President of ANEI. And I have a personal a relationship with Dr. Clara because she was a Chief Clinical Governance Officer of our hospital for 3 years, way back in 2017. And she has done amazing work in implementing quality systems in our hospital and various hospitals. And I've learned personally a lot from her as a co-assessor. We have done a few assessments together, and she has taught me a lot about assessments. And she's very passionate about nursing education, and she is a real nursing leader of whom the other budding nursing leaders look upon. Welcome, Dr. Clara.
Thank you. Thank you, Dr. Manivannan. It's a great opportunity for me to be one of the panelists, you being the moderator. And I'm really marking this day as a special day for me. As I said, like it was always an inspiring time that I have with you and also with Dr. Pari and other colleagues who are here at CAHO. CAHO is always a happening place for healthcare and happening place for all of us as healthcare professionals. So today's topic that I'm going to deliberate next 10 minutes is about medication without harm. And specifically, I'm going to focus on the few areas that is very important for you delegates. Thank you for joining this session. And this is going to give us a great outlook. In 2017, WHO has visited that it is important not only to focus on medication in the hospital or in the system with the professionals, but also with patients and the caregivers. So this is what we are going to see now. And 4 important areas that I would cover here is related to the 5 moments of medication safety, which WHO has given, and what the patients must ask, find, reflect upon. So accountability is shifted to the patients now because they are the one who are responsible for their own health. And also we'll be touching upon health professionals can promote engaging by supporting patients in answering them and also in helping them to ask more questions, and role of a citizen as a citizen of India, because medication plays a greater role. Now to start with, I would like to put a base. Now what happens in hospital? In hospital, doctors and nurses play a greater role along with the clinical pharmacist and the pharmacy team supply chain in managing efficient medication practice. And when it comes to medication administration, nurses are the first and the last line of defense. We have got 10 very important golden rules which we follow, which we call it as a right. So these are followed, and we have a lot of systems like medication management. Nurse is a newer innovation. We have clinical pharmacists who do the daily rounding, health education, and distribution of teaching material. All these are happening in the hospital. But let us go back to what happens in the community, at home, in the workplace, which is not a hospital. And these are very important aspects. So WHO touches upon 5 moments of medication safety. Now, what are these 5? 1, starting a medication, then taking my medication, adding a medication, reviewing my medication, and stopping my medication. Why did we put that my there is basically to give the accountability for the people, the end user. In education, we have shifted our perspective from teacher to student. So in healthcare, we are shifting our perspective from care providers to care receivers. So to explain further on this, the first thing that any patient or any of the people or a public should know is ask these questions and find the answers. If you are not able to find the answers from the doctors or caregivers, do not proceed further in taking the medication. Now, what are these questions? Like, ask these questions and find the answers with the help of the healthcare professionals whenever you or wherever you go. Like visiting a doctor, a nurse, or a pharmacist, or a dentist. visiting a primary healthcare facilities or a pharmacy. We can even talk to our housemaid, talk to our people around us, talk to in the community. So they should know to say that when they are reaching these people, they have to ask questions. And if suppose you are admitted and you're getting discharged, are referred to another healthcare facilities. And when you have a treatment received, or you're getting a treatment from home or in a center where it is not a real roofed hospital. Now, what are these 5 moments? The first thing that we have to understand in the 5 moments are starting a medicine. So what should we know in starting a medicine? The name of the medicine is very important. Risk and possible side effects are very important. Another way to treat my condition. Ask doctors, what is another way? If I'm not taking this medicine, what is the other possibility that I can do? Store this medicine. How do I store it? And also, we should know whether we are allergic to it. When it comes to allergies, it is not that everybody knows what are they having allergy on. They have to understand that there are new allergies that can come anytime. Some of the drugs when you take or injections when you take, it will not cause allergy sometimes first time or second time. It could cause allergy probably in the 3rd and the 4th time. So it is important for us to have a track of it. And the second part that we know is taking my medication. When should I take the medication? How much should I take? Whether it's before food or after food? Is it related to food? Any food should I avoid or add on to the medication? If I miss a dose, what should I do? Should I take a double dose or should I continue the dose? How do I manage it? And then come to a normalcy and then know about the side effect and watch for side effect. And adding another medicine. If a doctor says, okay, I'm adding on this medicine, or he says that I'm increasing your dose, then it is important for you to understand why it is required. And then we need to have a understanding about any interaction related to like suspects. And also we should see that my healthcare professionals about the whether they have told you about the medication which already you're taking, whether you have discussed with them, because when they write a prescription, probably they wouldn't have asked in the history physical examination. Days are gone. Doctors spend more time with the patients to ask more about their background or healthcare history. So sometimes it is not possible. So in this case, we have to reveal it as patients or a patient's attendant and manage multiple medications correctly, which is important. And we will see how we'll do that. Reviewing my medication. So when it is happening, what we have to do it, have a list of all the medication, probably in the mobile or in a paper, or you can put a chit and keep it on the fridge. So know that these are the medications I'm taking. And when you know the drug, how you should know is you should know the name of the medicine, the type of the medicine, the dosage of the medicine, and when are the frequency of the medicine that you're taking. So with this, you will know your medicine. And then I take any medicine like for example, some of the medicines you have to take it in for a longer time. Some medicines you don't take it, you have to stop it. So which should I continue, which I should not continue? Sometimes patients come back and say, you have given me this medicine 3 years ago and I'm continuously taking. For example, one patient came back and told, Pandy has been taken for 3 years. He has to stop it, but he didn't know about it because he also didn't ask about it. He continued. So such things are very important. And check my medication regularly and how often should my medication be reviewed. So they have to know about this. The last one is stop my medication. Never stop a medication by yourself. Like how you should not go to the over-the-counter and take the medicine. Never stop the medication or never change the medication by yourself until you consult with the doctor whom you have met and who has prescribed you this medication. You can have a second referral probably before you stop, but you have to have a clinical referral and understanding to stop a medicine. Never stop it suddenly because some of the drugs will cause withdrawal symptoms and will also cause more danger when you stop it. And what should I do when you run out of medicine? Sometimes certain medicines are not available in the market. Sometimes it comes in a different trade names. The particular generic name will be there, but trade name will be different. So you have to know like what are the differences, and that also is important. And also what you should do with the leftover medicine or a expiry medicine. It is very harm to keep it at home. So how do I discard and what is a pattern of discarding is very, very important. And stop my medication due to an unwanted effect. So when should I stop the medicine? That is also you should know. Probably you have to ask, suppose I get one particular side effect, can I stop it immediately? Should be your question. And then the doctor would say, yes, if you find this, stop it immediately, but come back to hospital for review. And these are some of the points that we have to educate the public, and it is important. And things to expect as a patient or a caregiver or family members, what we have to do: watch for any adverse reaction. Action of the drug should be monitored. Listen to your body. Listen to your body. Sit silently and see after taking medicine what is happening. Any drug interactions are happening. Monitoring correct level of drug in the body, and also resolution of symptoms and restoration of the health is very, very important. So if doctors say you have to take it before food, it has to be before food. You have to take it along with more water or plenty of water, then it has to be with plenty of water. For example, when you go to a CT, they give a contrast. Some patients, we have to educate them. If you know that, you have to educate patients. If you take any CT or any procedure with contrast, you have to come back and take a lot of fluids until it is restricted. So these are some of the things that the caregivers or the patients or the family members should be aware of. And what the patient must ask and find or reflect upon. The first thing is ask. So what do they ask? I already told you, but I'll again repeat. What is the medication for? How am I supposed to take it? How should I store the medication? How do I know that it is important? What side effect can I expect? Does this affect over the counter anything in medicine? So do I go for it or I should not go for it? And what do I do if I miss a dose? So they have to ask. So now we have to educate patients to have a slip and write all these questions and go to the doctors. So when they go, they can ask these questions so that they will be able to find an answer. And in the find, what they have to do is, what is the cost of the medicine? And what are the other treatment options available? Now, sometimes without medication, with activity and food alteration, you could do better in health. So this also should be asked. Also, sometimes patients think if the medicine is costlier, this we saw in COVID also, when the medicine is costlier, it does more good for patients. No, it is not so. It is not cost related. It is action related. So patients should be very much aware of it. Why do we have to ask about the cost? Is sometimes the drugs are taken for a long time. Once you start, you cannot stop. So better to start with the medicine that is appropriate to the patient, which is cost effective also and gives a better result. So this is important. Then reflect. What is the reflection talks about here and what we have to teach for the patients as a healthcare providers? What improvement is seen after starting the medication? If there is no improvement, they have to get back. And improvements have to be monitored. That's what I said, listening to your body. Listen to your body. Your body talks. All our body will talk to us. So we have to listen to the body. And monitoring for long-term complications. Next slide would again help you to understand about what are the challenges faced by the patients or the caregivers. Many times I have seen with my relatives, I have seen with my people, I am also getting old. So when I don't use my glasses for reading glasses, I'll not be able to read what is written in medicine on top, because many times it's a very tiny little words and tiny little numbers that are put there. So it is important that we need to know, we cannot have things in memory, and we have to be having a visual correct, never guess. Sometimes what do we do? Okay, without goggles, yes, I cannot see, read, but then I still try to read and then misunderstand and then take a wrong medicine. Hearing, again, hearing is difficulty people will have, and we have to, when we talk, we have to talk the terms that they understand. Dexterity. the difficulty in opening the box, inability to break a tablet. So these are some of the problems when that's why it's important the divided dose or the right doses to be given. And if at all it should be a broken one, the pharmacist or the hospital should have a divided doses. Maybe it can be cut and then it can be given to the patient so that they will be able to use it. Some patients will have difficulty in swallowing. I can see, because I've seen my parents, my relatives taking 10 to 15 medication. I don't know how they are swallowing. It's so difficult, even one medicine for us to swallow. So these are some of the things, and some of the tablets comes in capsules, some comes plainly, and even in the hospital, no. So a tablet that can be given for orally cannot be given in the rice tube, because it will never work, because you're crushing and giving. So we have to see the dexterity is very important. Scheduling logistics. Like, for example, when you're scheduling, you have to be very careful in understanding when should I take, which part of the day I have to take it. And the last one is, please set alarm and keep reminder, especially those who are very active and involved in work, household, travel, or in party on functions. Many times, what do? We skip a drug. So it is very important to keep an alarm, set an alarm. And it is that will help us to understand. And in what ways the healthcare professionals can promote engaging by supporting them in answering. So patients will ask questions. But what do? We shut them up. We tell them, when I tell, you do it. I have seen some of the doctors, some of the nurses speaking this way, but this is not right. So as a healthcare professionals, we should promote them asking questions. Now, what are the changes? What are the challenges like we face when we are helping the patients to overcome this? Is we have to help them by teaching methodologies. See, some of the patients will be a good listener. Some of them will be a good speaker. Like what is the principle of learning? Adult education, we use same thing we should use here. Teach one concept at a time. Teach back method with handouts. Show me a method where they follow. Then sometimes what happens, you can use computerized learning, or you can use some small comics or some probably a story. Stories are better to understand for people, and then demonstration. So when they view it, they'll be able to learn it. And when they demo it, demonstration is also a methodology. Like in our hospital, what do? All transplant patients, before they could get discharged, we set this as a 1-week program for them. So nurses don't give the medicine directly to patients before discharge. It is the patient's relative who gives the medicine, nurses supervises. So they do dually, they are responsible and accountable for giving. So they learn it over a period, and when they go home, they don't return to hospital with complication. So it is important, and the relatives or the patient should not feel hospital is asking me to give medicine, nurses are supposed to give medicine, doctors are supposed to do this. No, it is important for you to learn the skills right from hospital, and then you're discharge ready. And what are some of the challenges that we face is like sometimes language barriers, because now we see all kind of patients coming in, and we also have international patients coming into many of our hospitals. So these are some of the challenges. And even India, like it's a linguistic country, like you have so many languages, and cross borders, patients cross borders, go to different places. So it is important for us to have a language competent people to educate them, and level of understanding. So this is like the person who sends the message, who receives the message, communication principles should be followed here. And get prepared from day one of admission. This is what is a message we give at the time of admission. Tell the patients, you get prepared for discharge. So on the day of admission, you have to talk about discharge to them. Get to know your drug. Very, very important. These are some of the bold statements that they should know and they should see in the hospital, so that they are aware of. Patient knowledge, which are the common gaps you see, is like they will not know the medicine. They'll say, still we could see people talking about red, green and blue medication. It was like this, it was the other side. So it is important for us to know the name of the medicine, reason for taking the medicine, correct dosage, interaction and side effects, when to stop, and risk of excessive drug use. Very important, because excessive drug use will not only harm the patient, but it might harm the loved ones around them. So very important. Actions patients should take regarding medications are like keep a record of medicines taken. Again, I'm repeating it. Keep track of medicine schedule, like pill slotters, and knowledge of high-risk drugs and interaction. Recently, we found that it is important for us. Many times we get the medicine, look-alike, sound-alike is across hospital we have. But when you put the medicine in the patient locker, we don't think whether it is a look-alike, sound-alike drug or it is a drug of high risk. So it is important for us to even mark there. So same way, when we send patients home or when we dispense medicine, we have to very clearly say these are lookalike medicines too you have, and these are the high-risk medication. So these will help. Maybe color coding and giving them is important, or probably some pointers are given to the patients, relatives or patients. So this will help them as well. And report drug reaction immediately to healthcare providers. Report drug reaction to national health regulation and drug manufacturer. This is a responsibility of the management. So in the hospital, there is a pharmacy and therapeutic committee which will do. You can approach the hospital or you can directly report to national health regulation authorities, or you can do it through the hospital where you are going and seeking the treatment. So this education is very important to the public. Now, role of the citizen in medication without harm. I always say that whenever a newborn is getting discharged, tell the parents, ask the doctor, what is this medicine you're prescribing for my baby? Is it an antibiotic or is it a steroid? Please make clear that this drug does not belong to both the category. So this education is very important for mom and dad when you discharge. Same way, you also should know, they should tell them that they have to know your drug, avoid drug over the counter, and do not prescribe. Even to nurses, like we don't have authority to prescribe because we are all working in the hospital. We cannot prescribe medication. Prescription of medication is only for doctors, and doctors, those who are qualified to prescribe. And also carry your medication along with you always wherever you go, and carry it enough. Do not say that just one day I thought I'll go and come back. No, carry your bag. Doesn't matter. We carry so many extra dresses, no? So we can carry extra drugs as well, because we don't know whether the same medication or combination is available elsewhere in the other pharmacies. So it will become a havoc for us. And know the apps that are available, for the pharmacy apps that are available, and what are the areas where you can get the drug. And take drugs at the appropriate time and have a regular follow-up. Never shy out. Never shy out to say, I'm taking this medicine. Even among your people in the meeting, or probably where you're sitting together, or in the classroom, never shy out to say that I'm taking this medicine, because if you shy out, you will miss a drug and you will not be regular. And regularly you follow up, go back. You cannot continue a medicine for a longer time. Medicine is like a chemical. So chemical cannot be taken for a longer time. So we have to come back to check, so that you have to have a regular follow-up. Then download and share education material. Become an educator of the patient. So you have to teach everybody. It's not only patients, public. You're traveling by car or somebody sitting next to you, talk to them about this. If you're traveling by flight, talk to your neighbor. Wherever is possible, please spread the news. And it is important. Volunteer in your own community or in your apartment or in your village, and take every opportunity as an opportunity for you to be a representative for this particular hashtag, no harm, while taking medicines. And there is a short video for you to see here. And with this, we will close the talk and look up the best. So thank you all for giving me an opportunity. Let us take an oath. Like from now, at least 5 people around us, we are going to talk about how safe they have to be in terms of medication. and going beyond hospital and beyond your geography where we are working. And I request each and every one of the participants to take the oath with me so that we have a healthier and safer India, and we are going to save lives. If we are able to save one life, and that is a great blessing and karma that we are going to seek in our living in this world as a purpose. Thank you very much, Dr. Manivannan, for giving me this opportunity, and CAHO for giving me this opportunity. Thank you.
Thank you, Dr. Clara. It's really amazing session. When say most of the medications are taken by patients in their home. Actually, the patients getting admitted and medication delivery in the hospital setting is probably not more than 15%. Actually, remaining 85% medications are taken at home. Many times we prescribe drugs which are actually very high-risk drugs. For example, newly diagnosed diabetic, you give an oral hypoglycemic agent and you don't deal the complications or side effects and how to handle that. That has resulted in a lot of mortality and morbidity. And also, say, post cardiac surgery, especially after valve surgery, we give acetylcholine and other drugs. But patients are not educated about the importance of the drug. And where we operate on a lot of patients who come in government schemes, where literacy rate is very poor, and they take the medications for 1 month and afterward they leave it, actually. And we see patients with stuck valve and young patients dying because of a simple failure to educate them. And I think you have extensively covered the topic. And as I said, the patient taking medications is far more in number when compared to hospital-based drug administration. So we need to educate the patients. Not only our patients who are getting discharged are coming to OPD, as you said, we should become champions in the community and then start from our family and community, and that will go in a long way in establishing medication. Thank you, Dr. Clara.
Thank you, Dr. Manivannan.
Dr. Pari is actually a consultant surgeon at the Sundara Medical Foundation, Chennai. He holds an MS and DNB degree in surgery and also fellowship in Royal College of Surgeons. So people who have attended this lecture know that he is very passionate about quality and teaching. Being a clinician, active clinician, and passionate quality champion gives amazing combination that Dr. Pari can deliver fantastic lectures which can reach the audience. And he's also the founder of Skills for Med, a skill development center for doctors, primarily teaching into basic clinical skills as well as patient safety skills. And now Dr. Pari will be talking about more of an examples. I know that being a practicing clinician and active quality champion. So welcome, Dr. Pari.
Thank you, Dr. Manivannan, for those kind words, and thank you, CAHO, for giving me this opportunity. I've been given a motley of topics to discuss with examples. So let me start, with telling what all we are going to discuss today. So one is the topic of polypharmacy and conservative prescribing, and the second is about self-medication. The third is misuse of medication. The fourth is drug overdose, and finally, a topic which is very interesting is for all of us, both as doctors as well as patients and the general public, is the use of over-the-counter medication. That you just walk into the pharmacy and say, I have a headache, and the pharmacist gives you some tablets and you take it. So that's the over-the-counter medication. So let me start with the principles of conservative prescribing. So actually, I want to start an example of polypharmacy. So polypharmacy is a term which refers to the use of multiple medications for multiple medical conditions. Usually, elderly patients are a victim of this because, over the time, India at the time of independence had a life expectancy of only 45 years. Now, that has gone up by almost 30 years. 75 years is our life expectancy. And most of the patients whom we see in urban areas and even in rural areas are quite elderly, over 65, 70, and they have multiple medical conditions like diabetes, hypertension, asthma, many other things, and also infections. We're now going through a cycle of infections for the last 2-3 years. So for multiple medical conditions, they see multiple doctors and they have multiple medications. So because there is no single person, so So like many of the Western countries has this concept of general practitioner who can optimize these prescriptions for this, for the patients. But unfortunately in India, though we have general practitioners, they are also busy. Most of our general practitioners see 100 to 200 patients a day because of our population. So this sort of thing is not possible. So I took up one example. Actually, as a surgeon, we prescribe very less amount of medicines. So I had to dig into my medical colleagues' case sheet and take this example. So another important thing, especially, is in our thing, because of the IT boom, most of our elderly patients are living alone. The sons and daughters are all well educated and they move overseas. So here is one example: a 79-year-old man who lives alone. He's taken care by 3 caretakers who rotate in shifts. The last 3 months he's not been well and in and out of hospital 3 times. He suffers from diabetes mellitus, he has a chronic cough, he has coronary artery disease, there is heart problems, hypertension, an eye condition called glaucoma, asthma, and bronchitis. So you can see his prescription. It runs into 2 pages. Now I'm just put the names of the medicine, but if you can see the prescription, actually, because for privacy purposes, I did not take a snapshot. So it contains these tablets: metoprolol, atorvastatin, insulin injections, acetaminophen, furosemide, and some spray like mucomist, potassium supplements, lisinopril, cardiolol, lanoprazole, and all these. Some he has to take daily, some he has to take on alternate days, some 3 times a day, some once a day, some as required. So you can see the confusion patients can be put because of polypharmacy. So there are several strategies by which you look at a prescription to see whether you can reduce the polypharmacy. But what I want to do is discuss the topic called conservative prescribing. As Dr. Manivannan pointed out, when we are medical students, when we learned pharmacology, actually, we were taught to how to make medicines, and dispense them. Nobody taught about safe prescribing, and nobody taught about the concept of errors in medication errors. If you can imagine that an anesthetist himself took so many years to learn this. They are supposed to be the brain in the operating theater, and we are supposed to be the brawn. I'm a surgeon, right? So you can imagine how long it would have taken for me to understand this. So, but this is a concept I want to introduce to be included in the undergraduate curriculum of doctors. This is called conservative prescribing. Now, conservative prescribing not only limits the doctor to think just about what drugs they can prescribe, and also think beyond drugs. What do we mean by that? So suppose a patient comes with hypertension or diabetes to me. It is not just enough for me to just prescribe the drugs or to give an injection insulin. I need to also think of what are the lifestyle changes I can advise to the patients, like diet, exercise, and many of the other lifestyle changes which can actually control the disease in a better way than just the drugs themselves. So before writing a prescription, our prescription doesn't have a column or a row which talks about what are the lifestyle modifications you have to make, what are the additional things you have to do in addition to take the drugs. So that is the first point in conservative prescribing. Think beyond the drugs and practice more strategic prescribing. See, there is a concept in inpatients called medication reconciliation. So what this means is, whenever there is a transition between points of care, suppose a patient is transferred from the ICU to the ward, then before they come to the ward, the doctor and the nurses go through a process of reconciliation. See what all drugs have been prescribed newly in the ICU, what are the drugs they have been already taken, and then so finally the doctor takes a call and says, they can continue this, they have to stop this, they have to alter the doses of this. So this is called medication reconciliation. And if you could do this sort of strategic prescribing in the outpatient, when a patient comes to you, you just ask, can you give me your older prescription? What are the drugs you're currently taking? It takes time. And if you're a busy practitioner, you can easily train a physician assistant to do these things. So that practice of reconciliation and strategic prescribing, so that this will avoid duplication of medications. This will avoid many of the medication errors which happen when people go to multiple doctors and are prescribing multiple drugs. And the third is we maintain vigilance regarding adverse effects. This is when you're monitoring them on a regular basis, either as an inpatient or outpatient, is to detect these adverse effects, quickly. And that comes with, vigilance. It's just not, as a surgeon, I just go, see how, look at the wound and come out. I also look at the medication and see what are the adverse effects they potentially can have, and also keep a lookout for that. Another important thing is to approach new drugs and new indications cautiously and skeptically. We are all used to sitting, at the end of the clinic and listening to drug pharma companies, reps. They do a very, important role of informing us about the new preparations which has come. Mostly, actually, to tell you the truth, no new molecules have been coming in the horizon for the last 6 to 8 years, especially for antibiotics, which is a frightful, truth. But so what the drug companies are now doing is making combinations of the existing drugs. It is like making khichdi with different ingredients. So when such, combinations are made, drugs will interact with each other. So unless, they have done a lot of trials and all that, putting them new into the market can have a lot of adverse effects. So when such new drugs, don't jump into the wagon and start prescribing because the combination of drugs looks very logical. But what is the drug interaction? Is there any adverse event which can happen? These are the things which you have to, look at and also be very skeptical about it. And the other important factor is to work with patients on a more deliberate and shared agenda. As I said, not just with drugs, but in a whole, holistic point of view. And finally, instead of looking at short-term effects, what can I give for fever? What can I give for this infection? Look at longer-term, broader effects. One important example I want to talk about is the use or misuse of proton pump inhibitors. All that, almost it is like etc. We at the end of the sentence we will write etc. So like at the end of the prescription, most of the doctors will write a proton pump inhibitor. Now this proton pump inhibitors can cause renal failure. I have seen patients who have had acute renal failure and have to go on dialysis just because they have been taking these proton pump inhibitors that are antacids, right? One type of antacids for a long period of time. So when you look at the prescription, look at longer term, broader effects. And so there is a very nice article from JAMA. You can just Google it, Principles of Conservative Prescription. It came out recently. And if you're interested, you can read on that. So that is my first thing about polypharmacy and conservative prescribing. The second of which I have been given is the topic of self-medication. And here is an example of a self-medication gone wrong. Mr. Kumar is a 45-year-old IT professional. He had symptoms of upper abdominal and chest pain for a few days. I'm sorry, he Googles, I think there's a typo there. We all want to cancel Google, but it's a typo. He Googles and finds out this sort of symptoms. The most common cause is acid peptic disease. So he goes and buys some antacids over the counter and uses it regularly. And he keeps getting repeated attacks of such pains. But this goes on for a few months. But one night, the pain becomes very severe and he's taken to the emergency department where he's diagnosed to have coronary artery disease. So this is a very, common occurrence. Many of my medical colleagues have also, are very guilty of self-medication. All of us are, as doctors and nurses, we are very guilty of self-medication. And we tend to, as doctors, we tend to sort of underestimate our health and our ability to perform. But what is the problem is, if you do self-diagnosis and if you self-medicate yourself, there are a lot of dangers. And this particular slide highlights it. So one is, you are not capable of doing a diagnosis just by, referring to Google or referring to an article. It requires a doctor who studied, his education for basic education for 5 years, and probably takes another 10 years to specialize to make an accurate diagnosis. And also it, delays the diagnosis, like you see in this example. If this, IT professional had gone 2 months prior with this to a doctor, the basic thing is just an ECG or a few investigations. They would have found out that the arteries to his heart are actually narrowed, and he could have prevented a heart attack. Because once a heart attack happens, your heart muscles are dead. And whatever you do, you are living with a heart which is not as efficient. Whereas if you do interventions before a heart attack, then you can actually expect to live a longer and healthier life. And then by taking self-medication, there are adverse reactions and dangerous drug interactions. You can also take not in the proper dose, and you may take it in the wrong route. And finally, certain painkillers have a tendency to have drug dependence and danger to abuse it. So this is all the dangers of self-medication. So I would very strongly recommend all the people who are attending this thing to for yourself and your near and dear. Don't self-medicate. Don't try and make your own diagnosis and take medications on yourself. So go to the doctor, get a diagnosis and do that. However trivial the symptoms are. Now you can probably wait for a day or two, but if the symptoms don't subside, it is better to consult a doctor. So that is about self-medication. Now we come to the misuse of medication. There are several ways in which medications can be misused. I'm going to give a few common examples. Here, the most common thing or the most common term which has been now coined for misuse of medication is called non-medical use of prescription medications. Now, what does this fancy term mean? It is that I go to a doctor, say, for example, fever, and the doctor does all the investigations, prescribes me an antibiotic, prescribes me some drugs to reduce the fever, and maybe some other drugs. For my cold and cough, they give some antihistaminics, and I get the prescription and take it. Now, when, again, after about 2 or 3 weeks or after a month, one of my family members seems to have fever and the same symptoms I have. So I didn't actually take the medications as the doctor prescribed, and I have, in my drug box, a few of these drugs remaining. So these are prescription drugs, no doubt, but they have been prescribed to me. Now I use this prescription drug, which has been prescribed to me, to other people in the family or other things. So when you use prescription medications, that is a non-medical person uses a prescription medication and gives it to other individuals, it is called non-medical use of prescription medication. This is rampant throughout the world and a major cause of adverse reactions and even death. It is estimated, almost lakhs and lakhs of people actually, having a lot of suffering and death because of this particular practice. So it is defined as the use of prescription drugs, whether obtained by prescription or otherwise, or other than this manner, for reasons or time period prescribed by a person whose drug was not prescribed. So again, when they did a study where it is common, they found medical students are the most guilty of this. Okay, and the common drugs which are sort of misused in this way are painkillers and antacids. These are the common drugs. As I said, some of the painkillers can have a tendency towards abuse, and though our pharmacies are not supposed to do this, give it over the counter, when they show the prescription, they will dispense it. So if you are using it for yourself, it is fine. But if you use a prescription to give it to somebody else, then this becomes a major problem. So this is one of the very important or common causes of misuse of medication that we come across. So the second is stopping medication. So stopping medication has got several ways in which you can do. One is missing or skipping medication. This happens every time. I actually take medicines for hypertension. And when I'm busy or when I have a prolonged surgery or for several reasons, I do miss it, for a day or two. So, but another thing is you can miss for the best time to take it. For example, certain drugs are best taken before meals. Certain drugs are taken, before the attack happens. For example, inhalers for asthma. There are certain drugs, as inhalers for asthma, which you need to take regularly. That will prevent your exacerbation, other further attacks of asthma. So missing the best time to take it is another way people misuse it. Failure to take treatment. So you take antibiotics for 2 days, your symptoms look okay, you stop it. Then what happens is these antibiotics the bugs become very familiar with the antibiotics and they become resistant to drugs. So one of the common causes of antibiotic resistance is not taking the adequate course of antibiotics. And certain antidepressants, if you're taking that, if you skip medications, you develop withdrawal symptoms. And as I said, resistance to infections is another very important reason when you stop medication. Or if you don't take medications for these diseases like hypertension, because these don't cause any symptoms. So hypertension can be there for years without causing symptoms. Same with diabetes. But if you don't treat them, you develop complications like heart failure. And in diabetes, it can cause blindness, it can cause foot infections, it can cause heart problems. There's several problems. So people tend not to take or stop medications which are prescribed to them, and that can be a problem. So what you have to do is to talk to your doctor. If you're not able to take the regimen which has been prescribed by you, genuinely, and you're stopping it for that, you strategize your drug intake and you talk to your doctor. The opposite side of the problem is also true. If the doctor says take the this antibiotic for 5 days or these antacids for 5 days, not stopping the medication. I gave you the example of pantoprazole, the proton pump inhibitors. Many patients fail to stop taking the medication. Dr. Clara also talked about this. So this is another major problem which can happen. So that is the topic 2. Let me switch to the, all right, sorry, I forgot. The other is taking expired medication. So why should you not take expired medication? One is they lose the potency and the chemicals deteriorate over time. So that is the reason every medicine has got expiry date. So it is a very good practice. So before you take the medication, to look at it. I remember my father, whenever he bought any medications, he will not fail to look at the expiry date and then only buy it. Now, we don't do it most of the time. So it's very, very important to take the medications within expiry date. I have put a question mark about, is it unsafe? That's because if you look at the literature, there are conflicting views beyond it. I don't want to confuse you, but basically, it's not that you're going to be poisoned or anything like that. Just remember that. It's not that you're going to become to major harm by taking expiry medications, though a few medications may cause it, but mostly they don't have the potency and you may not have the desired effect. So that's the reason you should not take expired medication. So you don't need to be worried. You take a medicine, expired medication, then you look at it, and then you don't need to panic. You're not really going to come to any harm. That's the point I wanted to make. Now, the other topic I want to talk about is drug overdosage. Now, this drug overdosage can happen either in the hospital, it is a medical error done by healthcare workers, or it can be done in the public or patients. So let us look at an example of an overdosage which happened in a healthcare setting. So a patient's heart stopped following administration of Levophed. This is a medicine which is given to in intensive care to keep up the blood pressure of patients who are in shock. So what happened was the nurse administered 3,000 to 8,000 times the prescribed dosage. Now, how could this happen? Okay, there are several safeguards which are there for medication administration, both for doctors as well as nurses, before administering a patient, to make sure that the proper dose is given. Now, this is very famously called, like Dr. Clara talked about the 5 movements. Similarly, there are 5 rights of given medication. So one is you have to make sure you are giving to the right patient. 2 is you have to make sure you're giving the right drug. 3rd is the right dose, then the right route, and then the right time. So these 5 things, giving to the right patient, the right medicine, in the right dose, in the right route at the correct time is very, very important. So this particular problem happened when these safeguards were not in place. This is not happened in our country. This is an example from the US. So I actually want to mention this because medication error does not mean when you go to a very hospital which has got good reputation, it may not happen. And that is the reason why CAHO is promoting patient involvement. So if you are even a patient, I know the ICU patient cannot be involved in this, but otherwise, if you are awake and you're conscious, please get involved in the dosage when you go to the doctor. Make sure they write, these 5 rights are being followed. But here what happened is, because of lack of safeguards and lack of experience, the nurse was a new nurse who entered the ICU. She was not very familiar. And they're supposed to check off with the second nurse before giving the dosage. And she failed to do it as well. So multiple errors happened at multiple points. And this patient died because of this error. So this is an example of overdose in a healthcare setting. Now, in the public, you can have, after we prescribe, they go home, there can be accidental overdoses. And the victims of accidental overdoses are children. Why does this happen? Because of careless parents. I'm sorry to say this, right? We as parents, if you have young children, toddlers, or young children, they want to put everything in the mouth, right? So we need to make sure that none of these medicines are within their reach. It's very, very important to keep the medicines away at a height so that these children cannot access it. So very important, accidental overdosage, common in children, and we need to be vigilant. Now, intentional is usually taken by adolescents and young adults because they are frustrated with life or they have some major psychological problems. And the most common drugs which are used are the household drugs like painkillers and all that. So paracetamol actually a very harmless drug when taken in the right doses. But if you do overdose, it can affect the liver. So likewise, many drugs which are actually you may be having very, very harmful if taken overdoses. Similarly, sedatives, there may be elderly people who are taking sleeping tablets. Now, if these sleeping tablets are taken in overdose, that can cause problems as well. So that is a problem with intentional overdose too. Mostly it is to gain attention. They don't, they're not really, brave enough to die. They want to, have some attention by taking some overdose. But unfortunately, some of these drugs actually kill. So you have to be very, careful about storing the drugs at home. The other overdose, I'm not going to really touch upon is people who are misusing drugs, who use it for, for pleasure, opioids and psychostimulants. They can end up with overdose. And there are several lifestyle drugs, these wonder pills, the magic pills, which are marketed, and that also can cause obesity, stress, and all those things. So people are stressed, they keep popping these tablets, and they can end up in overdose because these are usually a combination of drugs. And as I said, the others are illicit drugs, which is a separate topic by itself. But the fact to remember is that anybody who is misusing these drugs, illicit drugs, can also end up in overdosages. So how do you prevent it? As I said, education and making sure you have safeguards to prevent overdoses. And if at all there's overdosage, early detection. You should know the symptoms. So depending on the drug, the symptoms vary. So the best thing is to take them to the emergency department as soon as you have some suspicion and have a proper drug storage at home. Elderly, again, Dr. Clara pointed that out, that how elderly, because of their inabilities, like inability to see, inability to hear, confusion, can have overdosages. And also another important point is any patient who comes with an intentional overdose should have psychological support. Now, that brings me to the last topic of my talk, and this is the over-the-counter. I'm going to talk about the Indian scenario. Actually, the over-the-counter medication has no local, Indian legal recognition. Many foreign countries have a separate category of drugs called over-the-counter drugs. But here we use what is known as scheduling of drugs. So we don't have any official category. So what we mean by OTC is when patients or public do self-medication, and when pharmacists just sell drugs without the prescription. So over-the-counter medication is this main two batches. So the common are what is known as the Schedule K, like paracetamol, liquid paraffin, these sort of things, and external like liniments and things like topical diclofenac. These are painkiller. As I said, prescription drugs without are sold without a prescription. Ayurvedic drugs and other traditional medicines. These are all doled out by the pharmacists without any proper prescription. Now, I want to raise this important thing. Why is OTC not being curbed by the government? Because there are two arguments. Because in India, where there is even today lack of access to healthcare facilities, they say there is benefit to OTC. I don't know how much I agree with this. And also, the cost. Many people cannot afford the cost of going and consulting a doctor. So these are people who are favoring the benefits of OTC. And of course, harms of OTC are inappropriate use, adverse effects, instructions for use is lacking, antibiotic resistance. But, this is why there seems to be a hesitation in coming down heavily on over-the-counter medications in India. And how can we optimize? One is control or optimize. So you do proper categorization. You say these are prescription drugs. These are over-the-counter drugs. Make a clear distinction, like most other countries, in the world. Most developed, Western countries have this. Or you should be, that good enough to monitor the prescriptions, which is not possible in our country. One is spreading awareness, where like this sort of programs telling, don't do over-the-counter practice, go to a doctor. And even if the pharmacists are giving the over-the-counter, make sure they have adequate labeling and make sure that the distribution and delivery is tightly controlled. So these are the things. It's a very broad problem. The government has to get involved in it. But from our individual point of view, the best practice is don't do this practice. Don't go and buy over-the-counter medications. Go to the doctor, get a diagnosis, and then get the proper medication. Thank you for the time. Again, thank you, Dr. Manivannan.
Thank you, Dr. Pari. It was quite informative, actually. Say, for people who are not, I don't know how many people are aware about the Swiss cheese model, actually. Swiss cheese model is something which prevents error, actually. A mistake done, it's a mistake proofing methodology. I think medication is actually, administration is something which needs such kind of a model to prevent errors within the hospital. And you also rightly pointed about the proton pump inhibitors and other things. We did a study around 8 years back within a hospital, found that around 70% of our inpatients were getting PPI or H2 receptor antagonist, which is not indicated. Some people are getting both, actually, H2 receptor antagonists as well as PPIs, which is not indicated. And inadvertently, these cause a lot of troubles. And so over a period of time, we tracked it and we reduced it. And over-the-counter medications, yes, recently also read an article where there was a study in India. The most abused drug in India is azithromycin, actually. So everyone takes azithromycin for, even before pandemic and after pandemic, it is aggravated. Everyone wants to take an AZ, they take 1 or 2 doses, but they leave it. And the next pandemic is going to be the drug resistance microorganisms, which we are seeing in the hospitals. It's not something which we read in paper and articles. We see in our hospital where multi-drug resistant patients are dying, patients coming for a different problem and dying for multi-drug resistant organ infection, and which the patients are also not questioning, and there is not adequate education among the healthcare professionals as well as public. I think you covered almost everything in your talk, Dr. Pari, as usual. As I
Thank you.
Said, listen to your lecture, it is a learning experience for me and recall for the overall protocols and other things. Thank you. The next speaker is Professor Dr. Sandeep. He is a senior principal scientist at CSIR and CFTRI. And Dr. Sandeep will be talking to us regarding, one thing is, we all think that medications, the multi-drug resistance came only from human population, but a lot of misuse has been happening in animal husbandry and other areas, which actually is transmitted to the community. So, Dr. Talking about this pertinent problem. Welcome, Professor Dr. Sandeep.
Thank you, Dr. Manivannan. So, at the outset, my thanks to the organizers for this. I'm basically a researcher. I'm basically a chemical engineer who worked in the pharma companies and now more into food and environment. So, any country like India, any amount of healthcare you create, my logic is that at least till 50 years of age, he should go to hospitals in a very minimal way. After 50 years, he may manifest multiple diseases. So, there are so many indirect influences on health, which is coming mostly through environment and food. But environmental issues, most of the people are aware, like air pollution, water pollution. One of the emerging issues is what type of food we eat and what type of contamination is coming in a big way. So, since I'm basically a researcher, we have to work at the frontiers of knowledge. Uh, so, in this regard, I want to just emphasize what are the emerging micropollutants and how there is a nexus between food and health. So, all these emerging micropollutants are because of the use of personal care products, disinfectant, and lot of pharmaceuticals which we are using, which find its way to the environment, and there is uptake in the food chain. Unfortunately, in India, even at the best research institute, there is hardly any study to find out how much is pharmaceutical drugs picked up by food, water matrix, and how we are directly or indirectly exposed. So only some terminology is used like antimicrobial resistance. Okay, so little bit study has been done in India. So I'll not talk. This is a sustainable development goals where clean water, sanitation, good health is one of the goals. I'll skip to this. These are some latest reports I'll send you. This is the presence of pesticides in spices. Okay. So I was just talking to some doctors because we also work with medical colleges here for some malnutrition trials with some districts and all. So even what we are eating, how much is the pesticide residues in the fruits, vegetable, which is coffee, other products which is coming to us, neither the big retail malls, neither any this e-commerce industries has any assessment of this. For example, you will hardly find anybody certifying you the rice you eat from the Reliance retail or the fruits vegetable which comes to you from the e-commerce platforms. Nobody has any methodology in place to certify whether it is excess pesticide free. And unfortunately, because of subsidy and larger availability of pesticides, less than 1 rupee, 2 rupee a packet, people are using very extensively in India. So you can see this is the latest report of all the foods. This is the various personal care products which are using for beauty applications from shampoo to various perfumery products. What are the chemicals involved and how these chemicals will finally manifest? Because our water availability is 1/6, population is 6 times more, and water availability is 1/6. So the concentration is likely to be more because high use of chemicals per capita 6 times less water availability. So this will manifest in the water chain and the soil chain, and it will be picked up by the food crops. So that is the rationale. Very toxic chemicals which not are toxic from a classical standpoint because of widely used. They are found to be safe for use on skin applications or use for pharmaceutical applications, especially antibiotics, I would say. This UV sunscreen is there. This is one of the potential carcinogenic compounds, and various veterinary drugs are there. So these are some latest reports in literature. So this is how the various human medicine, the veterinary medicine, how it will find its way to the landfills, to the soil, and uptake in the food chain. Unfortunately, there is hardly any research, even in the best institutes in India. This is one latest article. You can see the occurrence of cancer in one of the districts in Orissa. It is traced now to the over excessive pesticide use. I'm not talking of old studies. These are some latest reports. These are some of the water in various districts, Vidarbha, wherever some monitoring has done. India has built a very minimal amount of pesticide analysis in drinking water because this is very complex analysis. It requires very critical equipments worth crores of rupees. So, and doing this is a very laborious exercise. It requires a special type of training, expertise to do pesticide detection. So, and there are about 45 pesticides which are permitted today. So these are some studies which have been done. You can see in drinking water, it should be less than 0.5 ppb. You can see the ppb levels in Rajasthan, Vidarbha region. So ultimately, it will find its way. Okay. This is only one report. What is the occurrence of the some pharmaceutical drugs, anti-inflammatory drugs in water samples? You can see in India, it is next high to Nigeria. Okay. And these are very limited studies. My estimate is that it will be much worse than this. Now, this is an eye-opener study. This is one of the best monitored ETPs in a very clean country like Spain. They just detected whether after treatment of water in sewage treatment plants, because all your pharmaceutical product will find its way to the sewage. So conventional plant, you can see there are 66 pollutant detected and lot of pharmaceutical products are detected. There are some antibiotics which have indicated. Okay. Now in India, you can see this is the water which is very close to the pharmaceutical hub of India near Hyderabad. So this is one of the very unique studies which was done. You can see the amount of pharmaceutical compounds, including antibiotics, which is found. Okay. So if such studies are taken, I think we will know at least how much unwanted exposure of pharmaceuticals and other personal care products is there directly, indirectly through water and through the food chain. And India doesn't have more than 20% treatment because these pharmaceutical and personal care compounds will find its way into sewage. So India doesn't have treatment facilities for treating this. And even if the facilities are put up, conventional plants cannot treat this. So conventional plant works on biodegradation principles. So these are some reports how various will find its way into the food chain. So I have given some conventional cereals, vegetables. These are all reports from developed nations, how much you will consume each food. So you can see there is a wide accumulation of these compounds in various food matrices. And in India also, it is likely to be much worse than this. This is for model 6 crops, food crops. This is just how can you reduce the toxicity by changing the type of pesticide which is applied on the crops. So you can see even by choosing, by awareness, by using right type of pesticide and preventing irrational use, the toxicities can be severely reduced. These are some model pharmaceutical compounds in personal care products. I have written what are the pharmaceutical compound, whether it's antidepressant, antimicrobial. For example, we are using a lot of triclosan, which is already banned in most of the countries from 2017. Okay, so during COVID, a lot of triclosan was used. So this compound was unnecessarily used in India, even in the toothpaste. Okay. Now, for example, in most of the hospitals, you are using ethanol. Now, with ethanol, adding triclosan is actually foolish. Okay. And also adding in even disinfectant, quaternary ammonium salts is also foolish because ethanol has a very high antimicrobial activity. So, for what reason they are adding? I didn't understand. Okay. So this is accumulation of various pharmaceutical compound in radish. Okay. These are accumulation of various compounds in various food items, leaves. I'll not go into detail, but there is sufficient evidence to tell that all these compounds will be easily accumulated in various parts of the plant. Okay. Which because I can afford to have side effects of a pharma drug because I will take not more than 1 month, 2 months, 3 months. If you see, suppose you break the population of India to 100%, at least 70% or 50% people will not use pharmaceutical products more than maybe once a month or maximum 2 or 3 days in a week. Okay. You cannot have a population more than 50-60% depending on drugs. Okay. Because the way the life on this earth exists, all are supporting therapies. Okay. For example, this is automobile. 24 hours you cannot travel in an automobile. This enhances your comforts. 24 hours you cannot have television. So whether there is a entertainment, education or pharmaceutical products, they are meant to serve a purpose, not beyond a point. Okay. So that has to be understood. Any service whether medical, education, automobile, it has to do enhance your quality of life. And beyond some age, okay, you require very mandatory on a continuous basis. But my understanding is that till 50, you should have minimum, you can keep your health by avoiding lot of unavoidable stresses to the body. So this is carbazepine, one of the pharmaceutical compounds, how it is accumulated in carrot. Okay, you can see even diclofenac, okay, is accumulated in various parts of the plant. Okay. So you can see this is the toxicity level. Okay, so if you consume about 60 gram of carrot per day, the accumulation potential is very high to reach very close to safe limits. Okay, this is one risk assessment of daily exposure to pharmaceutical compound. So carbazepine has huge accumulation potential in carrots. So in India, since less of 25% of the sewage, which is the main carrier of all these compounds, so contamination is likely to be very high. Unfortunately, in India already research institutes and research domains are more towards not aligned towards preventive therapies. Okay. You will always see this city has 100-bed hospital, cancer hospital. Nobody talks of what is the water, what is the air quality. Both has to be taken together. Then only, because the country's per capita income is less than $2,000. 80% of this country is now as poor as Nigeria. Okay, 80% of this country. So tomorrow, even to maintain this facility, affordability, accessibility is not possible, even if I set 5-star hospitals in this country. So preventive is one of the best tools in India. Okay, so setting up your house in order. Okay. And also develop, see what happens, people will not stop using all these compounds. So at least your treatment plant, the municipal corporation, if there is a flyover made, it gives you convenience. Also the water which will be recycled back, which will come back to you, it will penetrate the groundwater, has to be treated properly by the municipal corporation. Okay. So in this regard, what we thought is, what are the technologies which can do this type of micropollutant removal? So at CSR, because I belong to Council of Scientific and Industrial Research, we also have a drug research institute, CDRI. We have IMTech Chandigarh, where streptokinase, one of the pharmaceutical products, came from CSR laboratories. So I am in the food laboratory, but we work as a consortium. So we have a theme on health. So CSR lab also developed this next generation technology to degrade all the micropollutant, pesticide, pharmaceutical compound which is coming, and this technology can be added as supplementary technology to the existing plant, so that that city or that village will get free from all these antibiotics or pharmaceutical compound, personal care products, pesticides, so that agriculture industry, pharmaceutical industry led micropollutant are taken care. So what we did was, we monitored this for all this technology for all the pharmaceutical compound, heavy metals, personal care products, including 28 pesticides, and so we have put in our own institute and we dose this. And recently we are transferring this to 2 apartments, because if you see Karnataka, most of the apartments, the same water is taken from the ground and recycled back to the ground. So it is expected that all this, suppose there is a 200 apartment complex in Karnataka, the same water, generally 1 lakh liters is the water consumption daily. So people are adding all the personal care products, pharmaceutical compounds in water. So it requires to be destroyed. So you can see the cost of the technology. Every apartment has to pay only 5,000 rupees one-time fee, so that their campus is free from all these compounds. Okay. A lot of research paper, because I am basically a researcher. You can see all the papers which are published in international papers. So this was one of the groundwater which was contaminated. So this also we tried to put this technology. Okay. So a little bit about my institute. I am from CSR, like DRDO, ICR, ICMR, CSR belongs to the group of laboratories under Ministry of Science and Technology. As if you may be knowing our famous Central Drug Research Institute and IMTech Chandigarh and IICT Hyderabad, where a lot of pharmaceutical companies are set up based on CSI technology. So we have, these are some of the features and the facilities which have at our parent laboratory. So with this, I thank the organizers for the opportunity. I will be happy if there are any questions. Thank you very much.
Thank you, Dr. Sandeep. Actually, being a scientist and researcher, you have clearly indicated, all your graphs shows that things are not right as of now in the environment. How many of you will know that way back in 2012 or 13, there was a study conducted by a similar organization, which has found that sudden decline in vulture population in the northwestern Maharashtra, northwestern India, vulture population is because diclofenac used in animal husbandry, because the heavy dose of diclofenac used in animal husbandry, and all these carcasses after death, all these carcasses are eaten by the vultures, and vultures developed renal failure and died. There was a sudden dip in 3-4 years. There was a huge dip in vulture population. And I think later government came up with an advisory on the dosage of diclofenac, or preventing, completely banning it in animal husbandry. I'm not aware about it, but this is something which was in my mind for a very long time. How a small drug could cause a huge environmental damage. I think Dr. Sandeep has clearly said that the drugs which are used in various industries or without proper treatment plans, I think go and come a food chain on a regular basis, which is dangerous actually. So whether in hospital or out of hospital, medication has to be treated with a very extreme level of caution. Underdosage or overdosage or appropriate dosage has to be administered, and dispensing these medications has to be under supervision, and a lot of education is required to the healthcare community, patients, as well as the public actually at a large, to reduce the errors over a period of time. I think the last 2 decades, the quality movement in healthcare in India has given adequate focus on medication safety. I think if this movement is taken ahead, then the errors can be prevented, and probably over a period of time, the pollution of the environment also can be prevented. And I thank all the speakers for the excellent coverage of the topic.
So first of all, I would like to thank Dr. Manivannan for making your time, sir. We saw your charismatic journey, not only in your hospital, but today in the whole moderation. You put your experience into it, made it very live, bringing those pieces of your connect, not only with the hospital, but also with the environment. That was really nice. Thank you so much.
Thank you. Thank you.
And Dr. Clara, you were so wonderful, very detailed. And I know this was too short time for you to cover the 5 steps and so many topics that you touched upon. But they were very much neatly said, and for a common person like us, it's a good insight. Thank you so much for your intervention and effort that was put in communicating. You took it from nurses to caregivers to everyone in the whole chain, in the value chain of the medication. Thank you for your inputs. Dr. Padi, I am in awe. Just like Dr. Manivannan said, when you speak, then we are all, the data, the statistics that you brought with case studies, that was very interesting. We could relate. We could relate our home scenario where we are taking medication in overdose, and you touched upon even the students, medical students doing it and going into guilt. So in whole, I felt the whole community was covered, from the perspective of being safe medication. So thank you so much for your effort and those detailed examples and keeping that privacy also on. Thanks very much, Dr. Parivalavan. Now I come to Dr. Sandeep. So thank you so much for your time and that extensive study that you have made in the research, bringing it to us. That was really awesome. You have put a lot of efforts in giving us that insight and on not only how the pesticides, the cosmetics, and also the pharmaceutical products can have an impact. And there's a huge responsibility that goes right from the manufacturers to the users to the whole people in the value chain of the healthcare sector. We all have a role to play, and you have proved with the data and statistics. So thank you so much. Research is such an important activity that you're able to gather and bring in front of us what we are facing day to day. So my words are less, that's what I should say. And you come from such a reputed institute in the country. We should definitely look forward for more research activity with your support. Thank you very much, sir. And my thanks goes to the leadership of CAHO for taking this special attention to connect with the stakeholders, especially the institution, all those institutions who made your time to attend and make this program such a grand success. Thanks for our leadership showed by Shobana from our team for making all this networking possible and all these institutions coming together. Thanks to the panelists who were there to support on the queries. Thanks one and all. Thank you very much.
Thank you.